Hi, I'm Sharrie Darlin-Davis, program host for Reid Beside You. And today our guest is Jacob Cox with Reid Health. And Jacob is the injury prevention coordinator, as well as, tell us your new title that you have.
I'm actually the EMS manager as well as the injury prevention manager for trauma services at Reid Health.
Oh, great. And that is because of our new acquisition in providing ambulance services
Correct.
to our service area.
Yes, correct.
So congratulations.
Thank
and
you,
welcome
yes.
to Reid Beside You.
Yes, thank you.
Today we wanted to talk about, well, actually, before we talk about the subject, how did you come to Reid?
Well, I actually took what we call a Taco U course in high school, where I took a college credits my senior year of high school and became an EMT and worked on the ambulance for about 4 years. Then became a paramedic and worked as a paramedic full-time in the Wayne County area. Then I decided I wanted to advance my career to become a nurse and work in the emergency department. So in 2015, I became a registered nurse and applied for the emergency department at Reid, and I've worked there since and continued working as a paramedic part-time or PRN for the Richmond Fire Department.
So you were a prime choice to become the manager over that area.
Some experience, yes.
We're excited to have you in that new position. But today we wanted to talk about summer safety. And some of the things when you hear about summer safety, there's such a barrage of different things that can happen. I mean, children are out of school, people are more relaxed. So some of the things that can happen in the summer, the first thing, especially recently, after we've just had the 4th of July, is fireworks safety.
Yes, yes. Just a few days ago, we had the 4th of July.
Yes.
And so as an EMS provider and now as a registered nurse in injury prevention now, which is trauma outreach, I really see the full spectrum of how the injury occurred, what we did for the patient to the hospital, and then what we do for the patient at the hospital. And so it's kind of fitting for me to be in injury prevention because I see the full spectrum. And fireworks safety is very important this time of year. On average, there's 180 patients that are seen in a day in emergency department.
Really?
Surrounding the month that July 4th is in. So really, common sense is the big thing. Make sure the fireworks that you're using or purchasing are legal within your state. There are different laws within each state.
And we have a wide service area encompassing 2 states.
Yes,
so.
Yes, absolutely. Yeah, it makes it, we're on the line there of Ohio and Indiana, so it makes it a little difficult sometimes. And make sure you have a water source available. If something gets out of hand or a fire starts, you need a bucket of water or a hose to put that out. Don't let children use fireworks. Teenagers are fine to use fireworks, but make sure there's adult supervision. Don't leave fireworks in your pocket. Sometimes accidents can happen and those can be set off. I've seen that in the past couple of years where fireworks were in a person's pocket. They were set off and you can't just easily pull those out.
Right.
And as a result, people suffer from 2nd and 3rd degree burns and sometimes have permanent damage to their extremities.
A lot of times people hand small children sparklers.
Yeah, sparklers
Have
are
you
huge.
seen some problems with that?
Yes, we see a lot of injuries with sparklers. Everybody thinks they're safe because they're not the big fireworks that go boom in the sky, but they're very, very hot still. And so sparklers are dangerous for kids. So if you do allow them to use it, I would not recommend that they have the sparkler in their hand. We see a lot of injuries to the extremities from those. So place the sparkler in something that's safe, that the kid is not holding, or if they are holding something, that it's something, an extension where the end of the sparkler is actually held on the end of whatever that they're using to control the sparkler.
And I just bet a lot of people didn't do that in the last week or so.
Yes, I'm sure they didn't. I know as a kid I did. So.
Another thing we see out are children on bicycles.
Yes, so bicycle safety is very, very important, especially in the summer months. So kids kids playing outside, we see a number of injuries, not just on bicycles, but across the spectrum. Injured on playgrounds, crossing the street, they get injured if cars don't see them. And, 9 months out of the year, 8, 9 months out of the year, we're used to not seeing as many kids because they're in school. But during the summer months, they're out and about, and we're typically driving down the road not expecting a kid to run out because typically we don't see them out as much. And so bicycle safety is very, very important. we see a lot of fractures and things from kids falling off bikes, but the most important thing is what we call a TBI, which is a traumatic brain injury, and that's as a result of not wearing a helmet. Okay. So wearing a helmet is extremely important. I brought a helmet, yes. Concussions is what we see a lot from bicycle-related injuries for patients that weren't wearing helmets. The more severe thing would be what we call a hemorrhage, intracranial hemorrhage, which is a head bleed. That's life-threatening. But concussions are the number one thing we see with head injuries, patients falling off of bikes and not wearing a helmet. In fact, of the fatalities in a year related to bicycle injuries, 90% were not wearing a helmet. So huge contribution to fatalities. So what's important about a helmet? It's important that you wear it. That's number one. But also that it fits correctly.
Okay.
So to fit a helmet, there's 4 things we do. So we place the helmet on our head.
Okay.
And I'll show this if you're okay with that.
Thank you.
Eyes is the first thing. So eyes, we look up. We don't want to see a majority of the helmet. In fact, we don't want to see the helmet at all. If we can look up and see the helmet, it's too big or it's too far forward. Okay. So we need to readjust it or buy a helmet that fits a little better. The next thing is ears. I don't know if you can see the side of this. I have it strapped in now. You want the helmet strap to make a V, so like the letter V, around your ear. That shows you that it's strapped in correctly. The next is mouth, and so we teach kids to open their mouth. When you open your mouth, you should feel the helmet pull down on your head slightly. If you do not, then this needs to be tightened a little tighter.
Okay.
And the next thing is chin. The last thing is chin. And that basically means take your one finger and stick it between the strap and your chin. And if you can fit one finger, that's okay. If you can fit any more than one finger, it's too loose and you need to make it tighter. So as you can see, this one fit me correctly. But a lot of times I see kids who are not wearing helmets or who are wearing helmets that are too big. And so we definitely want to make sure that those are fit correctly.
So how can we want to make sure that the parents are aware of those factors? Mm-hmm. And just don't jump on. I'm sure that a lot of children, they're so excited, and it's the summer, and they have a new bike,
right? And
they just take off.
Right, and it's difficult, for kids to wear helmets because it's not cool. It's not cool to wear helmets, and we see a lot of adults that don't wear them either, and they're a little uncomfortable, and they can be hot sometimes. But just being consistent is the big thing. Parents being consistent, making the child wear the helmet every time they ride the bicycle. As far as helmet fitting, the best thing now that we have social media and a lot of people have access to the internet, you can get online, just Google proper helmet fitting, and there's a number of resources that pop up and pictures that show you how to properly fit the helmet.
So that would be just a very good thing for parents to look and make sure that that helmet is fitting properly.
Absolutely.
I learned something today. Another big thing in the summer is water safety.
Yes, water safety is huge. Again, we don't see it in the cooler months because people aren't swimming as much, right? Indoors, correct. Yes, but outdoors they're not. But we do see drowning deaths in this area, not frequently. Drownings we don't see a lot of, but when we do see them, typically they're fatal. We used to hear about a near drowning or a drowning, and they don't use those terms anymore. It's either a fatal or a non-fatal drowning. So the person drowned, and how quickly they were responded to, so how quickly somebody pulled them out of the water, determines whether they die from the drowning or not.
And I know recently in the news, I've seen a couple more high-profile drownings, and each family said, I just turned.
Yes.
Just real quickly, in 10 seconds, I just turned around and they were gone.
Right. So it's a misconception that you're going to hear or see a drowning victim and know that they're drowning, and that's just not the case. Drowning victims slip away silently in a matter of minute or less. And you're right, that's what parents say. I just turned my back for a second and they were gone. And that's exactly how it happens. If you think about it, this person who's drowning cannot swim, and they're treading water, and they're trying to keep their mouth just above water. And so they can't scream. They're using all their energy to try to stay afloat. They're not thrashing about because the majority of their body's underwater. And so they do. They slip away quickly, and by the time they're underwater, especially in open bodies of water like a lake, it's hard to find them because it's not clear.
Right. Now, you did bring a life jacket.
I did bring a life jacket. So the number one thing we can do, just like helmets for water safety, is to always wear a life jacket, adults and kids, but especially kids, and especially in open bodies of water. There's currents, there's a number of things in the water, fish and just the different material underneath that can sweep somebody away or catch their feet and pull them underwater. But wearing a life jacket, even in a closed body of water, which would be like a pool, is very, very important. A life jacket should always be, I don't know if you can see this or not, but it should always be certified by the U.S. Coast Guard. And you can just simply look inside of the jacket and it'll say U.S. Coast Guard approved or USCG approved, which stands for U.S. Coast Guard. And then a life jacket fits based off of size or weight. So 30 to 50 pounds or 50 to 90 pounds, basically weigh your child, find a life jacket that's U.S. Coast Guard approved and that fits the weight that they are, and that life jacket should be good for them to use. Obviously, it's very simple. You make sure they wear it. You make sure that it's strapped on properly, so don't just put it on them. Make sure you actually clip the clips together or zip the zipper up. And then there's a strap that goes in between the kid's leg. And that holds the kid in from slipping out of the jacket, even for a jacket that fits properly. It keeps them from slipping out should something happen. And then for pediatric patients, so smaller infants, they have this little pillow that's built into the life jacket. And this, really what this does is if the kid is knocked unconscious or for whatever reason they're in the pool or in the lake and they go onto their face, so face down into the water, what this does is it flips them over to keep their head out of the water so they can breathe until somebody comes to rescue them. And then fitting a life jacket, again, make sure it's U.S. Coast Guard approved. Make sure the size is right as far as the weight. And then once you put it on them, snug it down. It doesn't have to be extremely tight, but good and snug. And then you want to take each shoulder of the life jacket and just slightly lift the kid maybe an inch or two off the ground. If the shoulder straps of the life jacket go up to the ear, that's fine. That's enough room, wiggle room, that's okay. But if it goes any higher than that, below their ear, up to their head, it's just too big and they can slip out of that too easily. So we want to make sure that we fit these appropriately.
Great. Well, you've given us a lot of information for summer safety, but and before we close, definitely remember sunscreen.
Sunscreen is very, very important. Always wear sunscreen. You want to reapply sunscreen after sweating or getting out of any water, or every 2 hours, or based off the manufacturer's recommendation. People can really get burnt pretty badly, second-degree burns from sunburns, and so sunburns hurt. We all know that, but they can be a little more involved than just being painful. There are different SPFs that we hear about, and really once you get into 50, 70, and 100, the percentage of sun blockage really only changes by 1%, so 97, 98, 99%. So really, I think it's a misconception. If I get 100, I'm blocking 100% of the rays, and that's not really true.
Oh, great.
Once you're 50 or above, you're about the same as the rest.
Okay. Well, we want to thank you, Jacob, for joining us today, and we are happy to have you. We hope everyone learned something, and hopefully they don't see you at their house because
That's right.
maybe there's been an accident.
Yes,
so,
that's right.
But we want to thank Jacob Cox with our injury prevention coordinator and manager of our EMS
Yes, ma'am.
services. So thank you, Jacob.
Thanks
for
having
joining
me.
us.
Yes.
Hi, how can I help you?
My daughter has a fever and she isn't feeling well.
Okay, let's get her feeling better.
Receive quality care within the comfort of your own home. Reid Health Now, right beside you.
Hi, I'm Sharrie Darlin-Davis, and welcome back to Reid Beside You. Our next guest is Stephanie Nicholson with the Reid Family Birthing Center, and Mary Smith, and she is with the Pediatric Center. And we are going to discuss World Breastfeeding Week.
Yes.
And welcome. And Mary,
Thank you.
some of our viewers might have seen, Mary has been on this show before.
Yes.
And but Stephanie's new.
Yes.
And welcome to Reid Beside You.
Thank you.
And how did you come to Reid?
Well, I've actually been at Reid for 20 years.
Okay.
I've been a registered nurse for the last 15 years. The majority of that time has been spent in the Family Birthing Center. And I am now the lactation consultant and perinatal educator of the Family Birthing Center.
Great. So, what are some of the major changes that have occurred in the breastfeeding area?
When we look at breastfeeding rates in the United States from 2007 until 2016, we had a change of about 74% of moms initially having any type of breastfeeding in 2007, and then by 2016 there was an increase up to 81%. But in Indiana specifically, we had at that same point in time 65% of moms starting out or ever breastfeeding, all the way up until 2016. We then increased to 76%. In Ohio, it was an even bigger increase. They went from 60% of breastfeeding to 78% breastfeeding in that same time frame.
So, are we seeing from formula to breastfeeding? What do you think has led that change?
Well, we know that breastfeeding and breast milk is what's best for babies, and families want to be informed. And so us giving the information to families helps them make the best choices for their babies.
So you're saying we have a more informed patient, more informed families. What's some of the benefits of breastfeeding?
So for children, the benefits of breastfeeding is that it reduces the amount of illnesses that oftentimes the children will have, from upper respiratory infections to problems like diarrhea. We know that breast milk is easily digestible, and that it's really the only food that babies need during the first 6 months of their life. We know that it decreases their risk of chronic illnesses and diabetes and obesity all later in life. Those are the top things for children.
Okay. And I know that breastfeeding is the biological norm, correct? What guidelines does Reid support in breastfeeding?
So our goal is that we want all moms to get the same information and to make sure that they are well informed so that they can make the decision that's best for their family. Reid is a baby-friendly facility, and Baby Friendly is an accreditation that is given to us by another entity. And with Baby Friendly, it's not just something that we get to tout that we have as a title. It's something that has to be given for us that we have to earn. And with Baby Friendly, we are accountable to provide the highest level of care in all methods of feeding for infants. And so that's not only with breastfeeding, but also with formula feeding families as well.
Okay. What are some steps for successful breastfeeding?
Well, receiving the information. That is a big point. And then just giving it a try. There's lots of help available here at Reid. We have the plan that all healthy babies and moms will stay together during their first hours after birth. That helps babies get to breastfeed as soon as they're ready to in the very beginning. And then it helps with getting them to staying together. Moms can get to know their babies. Babies can know that they can trust their parents to care for them. And so those are part of the things that we do to help make sure that families are getting that best start.
And one of the things I'm really interested in that the entire staff is trained.
Yes, yes. So every one of our staff in the first 6 months has 20 hours of breastfeeding specific education.
Okay.
And then we have 11 nurses or nursing staff who are certified lactation counselors at the Family Birthing Center. We also have 2 board certified lactation consultants just within our department. And that doesn't account for the Reid OBGYN office or even at the Peds Center.
Right. And through that, Mary, are you seeing more people when they first come in, when they early in their pregnancy inquire more about breastfeeding?
Oh, I think certainly they are better educated, better informed than what they were several years ago.
Okay. So that's part of the big change in the last decade, I'm sure.
Exactly.
So what are some of the services that Reid provides for new mothers?
So with Reid, we have the set where every mother, when she is going through the doctor's appointments, her prenatal appointments, they're all getting the same education. And then when they're coming to the Family Birthing Center, we are making sure that they're all getting the same care. We have Milk Matters for moms as a follow-up program where they can meet with other breastfeeding moms and give each other support. And there's always breastfeeding, professional breastfeeding support available to help display any myths that might be out there. We also have a follow-up program that is where families are given the chance to come back one time for a follow-up after they've delivered. And that way we can catch any problems that may be happening, that may have not been happening in the hospital, and helping those families out in that way.
And one of the things I noticed you always say are families. So you're trying to involve everyone. So probably a
Absolutely.
decade ago, you might not have heard keeping the family involved. It might have just been the mom.
Yes.
So what are some of the things that you do tours or you bring everyone in?
Yes, so we
Tell me about that.
have a Shared Beginnings program.
Okay.
And with Shared Beginnings, I offer tours. Families just make contact with me and they get to come in, they get to see the unit. And it is an individual time. We talk about the information that I want to make sure that they know, and then we also give them a chance to ask any questions that are specifically important to them. And we have that as something that's available for any family who is looking at delivering with Reid.
They want to do that.
Yes.
Then tell us a little bit more about Shared Beginnings.
So Shared Beginnings is my baby. I didn't start it, but it's something that I take full reins on. I do the education classes that go along with families learning about childbirth, breastfeeding, baby care. Those are the 3 big classes that we have, but then we also have other classes available as well.
And with that, I like to, when I see the Shared Beginnings, I think of like the little brother or little sister gets to come along and be a part of that process.
Yes, we do have a sibling celebration class.
Okay.
And that helps to get them involved
Transition.
even that much more, yes.
Great. What are some of the other things that you're seeing out, either one of you, with the big change within the breastfeeding, and then just what people? I'd like to just interject how probably 10, 20 years ago, people received baby formula. They had the baby and all the different things from baby formula companies and out the door. And this whole process has changed.
Yes.
So,
Reid is a facility that does not give out formula, because when we give out formula, it makes families feel like it is something that they should be using. And unless there is a medical indication, there is no reason why a family shouldn't be breastfeeding.
I can understand that. So, the other another thing is during the process, how do you work together? How does the Family Birthing Center and the Feed Center work together?
Well, before the families leave the Family Birthing Center, our nursing staff contact the Peds and Internal Medicine Center and make sure that the babies that are going to be going there have follow-up appointments with them. And we do that with any baby wherever they're going to be going.
Okay.
But specifically in the transition to the Peds Center, when they get to have their first appointment.
Usually what happens is the baby will either be scheduled with their primary care physician, which may be one of our pediatricians or one of the family practice doctors, or with one of the nurse practitioners. They may have that first appointment scheduled with me for a weight check and a lactation consult. So that's determined by the provider.
Okay.
So that's how that process happens. And that's usually somewhere around day 3 to day 7 that we see those babies for the first time.
I know that you also work with other groups within the within our service area.
Yes. So Reid is a member of the Wayne County Breastfeeding Coalition, where we work with the La Leche League. We also work with WIC and make sure that families have the breastfeeding support that is necessary. In addition, there are the Neighborhood Health Center and the Wayne County Health Department's clinic also have been able to provide lactation assistance for moms within the community as well.
So there's not an excuse. We have a lot of different
Lots of help.
areas that you can see.
We're very lucky in this area for that.
Well, we want to thank you, ladies, for joining us today and actually educating us about World Breastfeeding Week. And we want to thank both Stephanie and Mary for joining us on Reid Beside You. Thank you.
Thank you.
Thanks for joining us.